Hello everyone, I'm Jon Salmanton-García from the University Hospital of Cologne, and today we'll present you the latest EPICOVIDEHA publication, Simultaneous Onset of Hematological Malignancy and COVID-19. As many of you may know, EPICOVIDEHA is an international registry for COVID-19 patients with hematological malignancies. We collect retrospective cases of COVID-19 in hematological patients since the beginning of the pandemic, and we still continue recruiting them. It is a collaborative effort, meaning that we offer authorships to all our contributors once their cases are included into an analysis. So far, we have more than 150 contributing institutions in more than 40 countries. Back to our publication. We started with it because there was limited data available on simultaneous hematological malignancy and COVID-19 diagnosis, and definitely it was uncertain which was the impact of early versus delayed specific hematological malignancy treatment in such patients, and which was the outcome of these patients with simultaneous hematological malignancy and COVID-19 infection. We included hematological malignancy diagnosis within 30 days before COVID-19 or 3 days after COVID-19 diagnosis. Overall, we collected information from 450 patients, distributed in 26% of patients with diagnosis between March and September 2020, 37% of the patients with diagnosis between October 2020 and February 2021, 16% of the patients with diagnosis between March and November 2021, and 21% of the patients with a diagnosis between December 2021 and February 2022. The median age of our patients was 65 years old, and 60% of them were male. Overall, the 32% of the patients had 2 or more comorbidities, and the median time between the diagnosis of the malignancy and the diagnosis of COVID-19 was 11 days. In total, 85% of the patients had to be admitted in the hospital, and of those, 1/3 in the ICU. The main malignancies were acute myeloid leukemia and non-Hodgkin lymphoma. Regarding hematological treatment, we can observe how more than 80% of the patients receive it either before COVID-19 or after COVID-19. And regarding delayed treatment, with more than 1 month of delay since COVID-19 diagnosis, we can observe how this delay was more present in patients with Hodgkin lymphoma and patients with chronic lymphoproliferative disorders. As for the outcome, we evaluated the 30-day mortality rate. In a whole cohort, we observed a mortality rate of 31%. And if we look specifically for the different malignancies, we can observe 55% in acute myeloid leukemia, 45% in multiple myeloma, 23% in myelodysplastic syndromes and myeloproliferative disorders, 25% in lymphoma, and 20% in acute lymphoid leukemia and chronic lymphoid disorders. We also proceed with Cox regression in order to analyze which factors were associated with mortality. In the whole cohort, we could see how age, chronic lymphoid disorders, critical infection, 2 comorbidities, and the lack of treatment were associated with mortality. In patients with acute myeloid leukemia, age, critical infection, and the lack of malignancy administration. And in the case of patients with lymphoma, age, critical infection, the pandemic wave, and also the lack of treatment for the malignancy. With this, we can conclude that patients with hematological malignancies and COVID-19 simultaneous diagnosis should receive their hematological treatment as soon as possible and together with the COVID-19 diagnosis. That any supportive measures should be provided for those patients with chemotherapy-induced neutropenia, And last but not least, that whenever possible, a less intensive approach should be considered, particularly for patients with lymphoma. I would like to finish giving a huge thank you to all the contributors of cases in this research. And just remember, in case you want to participate and contribute cases to EPICOVIDEHA, feel free to send us an email or to contact us via Twitter. Thank you very much and see you next time.